I started at Nacro nearly 10 years ago now as a team leader, particularly working with young people in custody. Since then have been in a variety of different roles, primarily within justice and health. Now in my current role, I am Director of Justice and Health and Business Development, so I look after prison, probation, substance misuse and mental health services nationally, and all of our tenders and re-tenders for new business. So within our Justice and Health division, we work with people who are in custody, we work with people who are coming out of prison, people on probation. So in all of those services, primarily to support them with structural resettlement needs. So trying to find them a house, a job, trying to reintegrate them with families, with society, so community integration activities, supporting them with their personal wellbeing needs, mental health concerns, family support. We also deliver services in police custody and in courts, so that's liaison and diversion services, with the aim to divert people out of the criminal justice system before they become entrenched. In health, we deliver substance misuse services in the community and in custody, so supporting people who have concerns with alcohol and drug use, and we also deliver mental health services for people coming out of the London prisons. So we've recently got some additional funding in our Recovery Near You substance misuse service, which is really exciting. So really joining up people who have substance misuse concerns in prison and then who need our support once they come out. So we've got in-reach workers who are now going into the prisons to kind of build those relationships, build those links before people come out to increase their chance of engaging with them once they're released. We've also got a pregnant women's worker within that service who's really focusing on how do we reduce harm to both the mother and the baby whilst they're pregnant, but also how do we support the other children within that family. We've had a real focus across the team on going out, and we really needed to do that during the pandemic. So we've got an outreach worker who's been working in homeless hostels with people who are street homeless, been delivering brief interventions around the city to really bring people into treatment, or at least to deliver harm reduction interventions out into the community. So there's some really great work happening there. Our CRSS service is our criminal record support service. That service primarily works with individuals to support them to understand disclosure of their convictions, whether that's with regards to obtaining a job or accommodation, or if they need to disclose their convictions for the purposes of travel. We also work with employers to support them to understand how to engage with people who've got convictions, the checks that they might need to do for particular roles, and how to risk assess individuals with convictions with regards to bringing them into employment. We've just launched our new 3-year strategy. So our strategy has a real focus on our service users and also our people. Our people are absolutely our biggest asset. It's one of the reasons that I love working at Nacro, is people that I work with, people who really want to make a difference. And to me, that's what I get excited about, the impact that we have on service users and on the communities within which we work is the reason ultimately that I think a lot of our staff come to work every day. It's certainly the reason that I do.